Welcome to The Explainer. Today, we're building a practical playbook just for pharmacists, all about managing stable angina. We're going to focus on those key counseling points, the ones that can make a huge difference for your patients.
All right, let's just dive right in with a scenario that I'm sure sounds pretty familiar. A patient comes up to your counter with a new script for a nitro patch and asks you this. This question is the perfect setup, really, for all the crucial counseling points we're about to cover.
So here's our game plan. We'll quickly define stable angina, break down the two main goals of therapy, and then dive deep into counseling for both symptom relief and long-term risk reduction. We'll wrap it all up with some essential pearls and a look at your vital role in this.
Okay, first things first. Let's make sure we're all on the same page with the fundamentals, because explaining this well to a patient starts with us being crystal clear on what it is.
The absolute key word here is predictable. This isn't some random out-of-the-blue chest pain. Nope, it's a pattern. It's that classic story, right? The patient who says, it only happens when I walk up that big hill. That is stable angina, and that predictability is the key that unlocks our entire management strategy.
So that leads us right into the core strategy. When we're treating stable angina, we're really thinking about two separate but equally important goals.
I love this slide because it shows our two-pronged attack perfectly. On one hand, we're managing the here and now. We're helping the patient feel better today so they can live their life. But on the other hand, we're playing the long game. We're protecting them from a future heart attack. You'll see every single medication we talk about fits neatly into one of these two buckets.
Okay, let's tackle that first goal, improving their quality of life. These are the meds that patients can actually feel working day to day.
And here we are, right back at that opening question about the patch. That point on long-acting nitrates is the answer. You have to have that 10 to 12-hour break every single day, because otherwise the body just gets used to it and it stops working. And of course, the absolute non-negotiable red flag, you've got to ask about PDE5 inhibitors. That combination can be deadly.
Now for beta blockers. The whole idea is to just slow things down, give the heart a bit of a break so it doesn't need so much oxygen. But listen, if there's one thing you hammer home with patients, it's this. You can't just stop taking them, ever. The body gets used to them, and if you stop cold turkey, you can get this massive rebound surge in heart rate and blood pressure. So always counsel on tapering off slowly.
With calcium channel blockers, you kind of have to think of them as two completely different families. You've got your dihydropyridines, think amlodipine, which are great at opening up the arteries, making them a perfect partner for a beta blocker. Then you have the non-dihydropyridines, like verapamil and diltiazem. These guys act a lot more like beta blockers themselves, so you have to be super careful if you're using them together. Knowing that difference is absolutely key.
All right, let's shift gears now to our second big goal, minimizing that long-term risk. These are the foundational meds that protect the patient's future. For antiplatelets, the message is pretty simple. Low-dose ASA is the absolute cornerstone of therapy for pretty much everyone with stable coronary artery disease. It makes blood platelets less sticky, preventing clots. If someone can't take ASA, clopidogrel is your go-to backup. And ticagrelor? Well, that's more of a special teams player for very specific, high-risk patients.
With statins, it's so important to explain that their benefit goes way beyond just lowering a number on a lab report. Think of the plaque in their arteries like little volcanoes. Statins actually help stabilize that plaque, put a hard cap on it, making it way less likely to erupt and cause a heart attack. That plaque stabilizing effect is huge.
And this chart right here, this is the proof. It's from the famous TNT trial, and it shows exactly why we push for high-intensity therapy. Look at that difference. Going from a lower dose to a high dose of atorvastatin led to a 22% drop in the risk of major cardiovascular events. The evidence is crystal clear. For these patients, more aggressive is better.
So what's the magic number we're aiming for? Well, for our Canadian practice, the guidelines push for an LDL cholesterol target of less than 1.8. That's the goal. It really just reinforces that aggressive management strategy.
And rounding out our risk reduction toolkit, we have ACE inhibitors. Just like statins, their benefit is more than just blood pressure control. They have this amazing vascular protective effect. And what about that infamous dry cough? Well, that's your cue to swap them out for an ARB. Simple as that.
Okay, time for some therapeutic pearls. These are those quick-hitter tips, those little nuggets of wisdom that help you really fine-tune a patient's regimen in your daily practice.
So we're talking about smart combos, like pairing a beta blocker with a dihydropyridine CCB to avoid slowing the heart too much.
It's also about holistic care, remembering to encourage that flu shot. And for our patients with diabetes, knowing that SGLT2s and GLP-1s are now top choices because of their heart benefits. But really, the thread that ties all of this together is adherence.
And that brings us to our final and maybe most important point. Let's pull this all together and think about your role in this. Because what we do is so much more than just putting pills in a bottle. So, I'll leave you with this question to think about. Beyond all the clinical checks, what's that one open-ended question you can ask that really tells you what's going on? Maybe it's, what's been the trickiest part of this new routine for you? Or, talk me through what you do when you feel that chest pain coming on. Because at the end of the day, our ability to connect and communicate, that's just as powerful as any drug in this playbook. Thanks for tuning in.